The end of my shift is a very important part of my day. And so, what goes into this is number one, rounding on all of my patients, making sure I'm current with their current condition, communicating with the patients that I will soon be leaving. And if I know who will be taking over for me, mentioning their name, if appropriate, managing them up, and letting them know that we would be doing bedside shift report as this is the best practice, and we would like them to be involved in that process. And that's what patient-centered care is all about. I also want to make sure I'm taking this time to take a look at any outstanding assessments that I need to complete, any outstanding medications or interventions or evaluations that I need to close the loop on. This time period is also a good opportunity to evaluate level of priority. And so what I would be doing is taking a look at my assignment and trying to help my oncoming colleague identify who's high risk, high acuity, who's somebody that would be a watcher or somebody that's low acuity. And that information would be really instrumental to helping them shape how the beginning of their shift goes. These would be the essential parts that I would focus on towards the end of my shift. I've been in this type of situation on many occasions where there's a possible short staffing issue. And so overall, the sense of and morale of the team is kind of diminished. And so I see myself as a clinical leader. And so I think better understanding, pulling the team together and having a huddle at that moment would really be very important. Better understanding the situation and what kind of led to the short staffing. If we anticipate that that's going to be what our staffing is for the remainder of the shift, or if there will be changes to that during the course of the day, will help us plan appropriately. I really like to pull everybody together and kind of say, okay, this is the situation, but we're going to make the best of it. We're going to make sure we're going to get through this together and that we're providing safe patient care. And so better understanding the high risk patients on the floor or any type of procedures that are upcoming, any patients that look like they're at risk for deterioration would be essential for everybody on the unit to know. Trying to understand from nursing leadership whether they fully understand the current situation and if they have any information that's important for us to be aware of. And so we would get through this together and agree to huddle at a certain frequency to check in with each other. In order to make the decision to delegate a certain task, it's important to understand scope of practice, competency and experience level, and also better understand the hospital's policies or procedures, any regulatory body standards, such as the Joint Commission, for example, and if there are any specific laws within the state. And so in this type of scenario, the patient is going to be at higher risk after receiving a sedative. It is not something that I would delegate to an LPN, primarily because while they can gather vital signs, part of what goes into this portion of assessing the patient, something they're unable to do, which is assessing the patient's response to the medication, how their airway is, and that is something that would be outside of the scope of an LPN. So I would go ahead and take that responsibility on to myself. And so making sure this is in line with the hospital's policies would be important. But nonetheless, this is something that I would make sure that I am responsible for.